Hey, so I am really, really super excited for tonight. I've sort of, Christina made like said little hints here and there about you joining us tonight, but I really am truly excited. So I first started following Christina's work just because of our kind of shared background in terms of neurodiversity. But I have since come to understand that she actually in many ways I think exemplifies um, the path that I would hope all of us are on, and we can encourage others to also be on in terms of really questioning our Western traditional models and stepping into a more decolonized approach. So I'm really, really excited. I am gonna just give you a little bit of background on her. So Christina is a late diagnosed AUDHD educator, former psychotherapist, and course creator with a PhD in English literature and over 13 years of clinical experience. Her work bridges trauma, healing, Buddhist and animist practice, and systems level critique. She creates initiatory spaces that blend science, soul, and lived neurodivergence in the service of collective remembering and repair. And I hope that at some point in her conversation with us tonight, she'll tell you more about the really exciting course that she is currently running, and hopefully will continue to run many iterations of, so that you can check it out in case you have clients who are neurodivergent or yourself identify as such. So without further ado, Christina will hand it over to you. I don't know if you have slides, because if you do, then I'll do the co-share thing.
I did not prepare slides. I mean, I have lots that I could show, but I'll ask you to give me the co-share if it comes to that. My approach tonight was really to see what the group vibe is and what you all most would benefit from. So I want to start by saying thank you so much, Bibi, for inviting me, and I'm so honored to join your space, and I feel very much aligned with the purpose and the ethos of this group. Um, I'm going to tell you a little bit more in depth what my story is, and then there are any number of ways we could go depending on what piques your interest, what ignites your passion, what you most want to focus on tonight. So, um, I began my career as an academic. I did study some psychology at the undergraduate level. At that time, I was undiagnosed ADHD. So I had a very particular, very passionate approach to learning that was very sort of all-consuming. And I found the psychology that they were teaching at the undergraduate level did not resonate for me with the kinds of questions I was asking myself. So the studies and the statistics just weren't getting at the heart of what I was grappling with, which is um, why, and I don't know if it's okay for me to use profanity. I will keep it clean. But
Okay.
okay, why is the world so fucked up? Like, this was a really driving kind of obsession for me by the time I was an undergraduate. I wanted to understand um, why violence was so endemic to human nature. I wanted to understand why society functioned the way it did. I wanted to understand why we do harm to each other. I wanted to understand the psyche. And so it was actually literature and philosophy, but more so literature that spoke to me on that level. I felt that I was looking for the people who were grappling with these really, really deep ethical questions. Um, so in my graduate work, I went on to study a lot of post-colonial theory. My thesis actually centered on how the Bible was used in the colonial project and how that was reflected in the creation of the Canadian nation state and in Canadian literature and in many different Canadian authors who were sort of interrogating the biblical narrative in their work. And as an academic, um, I think what I eventually really struggled with was my sense that I could not have worded it at that time, but it was really around the limits of the analytical mind. And I felt that there was a way in which we were all sort of arguing great points, but we were missing something. We were missing the depths. And of course, part of what I was feeling into was the unconscious, was the fact that the analytical mind does not explain, human nature, does not explain why we repeat traumatic patterns, does not explain the depths of what's going on under this analysis. So I then trained to be initially a psychodynamic therapist. It was a 6-year training. It involved 4 years of compulsory group therapy, which was incredibly illuminating for me. Um, and for reasons I probably will never fully understand, my practice as it evolved increasingly centered around people who had suffered quite extreme child abuse. So I ended up with a lot of patients who were very far along the dissociative spectrum and increasingly sought out in my advanced training experiential methods of working with them. So I didn't want, I sort of realized that insight was sufficient, or it was necessary but not sufficient for change. And I wanted not only for people to be able to reflect upon their experience and to be able to make those connections, but also to have a new experience with me in therapy. So I've studied EFT and IFS and AEDP, and was increasingly trying to sort of incorporate this trauma-informed somatic understanding into what was happening in the therapy room. Um, so that really shaped the way my practice sort of pivoted. It still had that underlying emphasis on, psychodynamic elements, but it was about the experience that was happening now in the room. And that was dovetailing with the deepening of my meditation practice, which became a really critical part of my own healing, which was really around coming into my body, coming into the present moment, accessing something deeper than thought, deeper than emotion even. And the other really pivotal um, sort of catalyst for the way my practice changed was my work with indigenous patients. So I'm in Canada. Our history with Indigenous people is very similar to the States. It's horrific. It's a combination of outright genocide and cultural genocide. So we um, we sent generations of Indigenous children to residential boarding schools. And there's a program under Health Canada that funds the therapy for the direct descendants and relatives of residential school survivors. So these were the Indigenous patients that I was working with. And very soon into that work, even though I was continuing to accumulate more embodied understanding of trauma and how trauma works, I realized that I was really ill-equipped to work with them because their understanding of healing was so deeply grounded in spirituality. And there was nothing in my training that had addressed what I came to see as the foundational trauma of colonization. And so, what this really catapulted me into was a very deep process around my own white privilege, my white conditioning, how white supremacy had made me sick, how to become accountable for that sickness in all the ways that it shows up, um, how to so it was sort of a combination of healing my internalized privilege, which is of course lifelong and ongoing, and also healing the breach in me, the breach in me from the connection to the living world, the sentient, all the sentient life that surrounds us. And so in the course of that process, I worked first as a patient and then as an initiate with a medicine woman here in Toronto, in the Toronto area. So initially to receive treatment from her to better understand that knowledge system, and then to be initiated into rites so that I might repair my relationship with, come into right relationship with the land, come into right relationship with our non-human kin, heal that sort of spiritual gulf that I realized was really impeding my capacity to facilitate healing in other people. And that was really sort of pivot point for my entire life. It led to many, many different revelations. It led to a very fascinating process of another layer of healing my own fragmentation, my own dissociation, and my deepening of my understanding of how dissociative processes are operating not only at the individual level but at the cultural level, and what it means when we sort of try to heal that breach, because we're calling up a lot from the collective unconscious when we do that. Um, so it was a fascinating process. At times it was a harrowing process, but it changed my practice, and in some ways it kind of set an expiration date for my practice as well. I think that expiration date was already coming for a number of reasons, one of which was that I was undiagnosed ADHD and I was in and out of burnout, pretty severe burnout that was increasing in intensity. I was also in a perpetual struggle with having to having to function with insurance companies and feeling ethically strained by that dynamic. Um, but ultimately, for a number of reasons, I did end up closing my practice at the end of 2023. And so what I've been doing since then is building courses. I was initially leading in-person retreats, and that has yielded more into creating two courses. The first one, Transcend, which is a blending of psychological and spiritual principles, which really draws on um, my lived experience as a clinician and also as someone on a spiritual path. So very much on my own healing journey, which has never been separate from my professional life. And then the more recent one, which is Neurodivergent Rising, which has come on the heels of my very late diagnosis with both autism and ADHD, which answered many, many, many questions, but also confirmed so much of what I had come to mistrust about psychiatry, about psychotherapy, about the whole Western medical apparatus, including its roots in capitalism and colonization and white supremacy and patriarchy. So these two courses are both for they're for anyone. They're for clinicians. They're for patients. Neurodivergent Rising is built on the voices of neurodivergent people. So including five guests, international, or sorry, nine guests, international guests, who are speaking from within their neurodivergent experience, and many, many, many videos and quotes, really showing our experience from the inside and coming to an understanding of why neurodivergence has been constructed as a disorder precisely because it it is by its physiology non-compliant with these systems. So, and I can go into as much or as little detail as we want to on that around synaptic pruning or around the DMN and the TPN, like different differences in the brain and the neurology, the nervous system, that mean that neurodivergent people are in some ways wired not to be socialized to these norms, which is not to say that we're immune from social conditioning. That is, of course, not true. We are also not immune from all of the foibles of humanity, personality, and character, and all of those things. Um, but it was profoundly validating for me to do this really deep dive in research and to begin to listen more and more to neurodivergent voices in contrast to the pathologizing clinical gaze, which is what I had been exposed to my whole life. And so I don't see any of these things as separate. The neurodivergent rising course is also deeply spiritual. We talk about the central wounding as the split between science and spirit that happened in Europe and the ways in which the dominant culture has severed us from all sentient life, which we're actually entangled with. If we look at quantum physics, if for those who are not comfortable with spiritual language, we can look at purely scientific language around entanglement. Um, so this latest course, which I'm almost finished teaching the live cohort of, is really the culmination of that very long journey. Like it incorporates my value for really deep critical analysis, which I think we need more than ever at this historical moment, because there is so much misinformation, because there is so much propaganda, so much gaslighting at every level of society. We need to have that. We need to be able to apply that critical lens. But it's also trauma informed. It also takes us into the processing of emotion, particularly the processing of emotion required when we are healing internalized oppression, or when we are facing our internalized privilege, because that's also a piece of the course, looking at how we've internalized and embodied ableism, looking at how we've internalized and embodied all of these systems. There's also a spiritual lens, which is that these systems are designed to reinforce the belief that we live in this world, described by Newtonian physics. We're objects, we're separate from each other, as opposed to what we know about the primary reality, which is that we are all consciousness and that all consciousness is entangled. So it's in my mind, the quote unquote treatment for neurodivergence is really deprogramming. And the course, is open to neurodivergent and neurotypical people alike. It's open to anyone who's interested in kind of deprogramming, understanding both our internalized privilege and our oppression, and coming to um, move towards different paradigms. So I just shared a part of a talk by Woman Stands Shining, the Danae elder, Pat McCabe, who speaks extensively about the thriving life paradigm. And we really learn a lot particularly from Indigenous teachers, from disabled advocates, from trans and non-binary, from particularly from Black activists, from people of color. So we're really uplifting all of the voices that see from the position of oppression the truth about these systems. And we're doing it in a way where we're in community, constantly reflecting on and moving towards what's happening psychosomatically, what's happening in our bodies as we reflect on these things, as we move into these deeper truths, as we question our programming. It's a beautiful community in which there's a tremendous amount of bravery and authenticity. And so this, for me, at this moment in my life, is kind of the embodiment of where my increasing faith in my own authenticity and moral compass has taken me. And I am thrilled to dive into anything that I've touched upon in greater depth, to answer any questions you have. I'm happy to share slides with any particular material that you really want to go deep into. I'm also happy if it feels right, if a meditative practice feels more aligned for people tonight, depending on how everyone is landing. But what I'd like to invite, first of all, is just anyone who's willing to share either in the chat or verbally. I don't know what the protocol is for this group or how people are most comfortable, but anything you noticed as I was speaking that either resonated with you, that raised questions for you, that lit you up in any way, or caused friction or discomfort in any way. I'd love to start with what's alive for all of you, because I'm not here just to talk at you. I want to really engage and get a sense of what's moving you in this very fraught historical moment that we all find ourselves in.
Well, I might start us off because so many things. Uh, one of the most shocking histories that I ever learned about was actually the history of Isaac Newton, and the fact that he was so deeply religious, and that he was religious first and a scientist second, and the impact of that on kind of the science that he put forth, and then the world that we have um, created in, as a reflection of that now. But I would love to, again, I don't know about everybody else, but I would really love to hear more about what you said about this idea of neurodivergent people being wired for resistance.
So you're probably referring to PDA, or what's commonly called pathological demand avoidance. Um, I will come back there. I'm going to do a little circle and come right back to it. Vivi, thank you for the question because it's a great one. So um, there's a great deal that I'm sort of summarizing here, but I will try to be succinct and clear. So one example of where non-compliance is kind of wired in is, for example, in the autistic brain. So the autistic brain goes about the process of synaptic pruning differently than the neurotypical brain. In the neurotypical brain, in the natural period of synaptic pruning that is occurring developmentally in early years, the synaptic pruning is largely mediated by mirror neurons. So what that means is that, um, sorry, this is the neurotypical brain. So the neurotypical brain, the synaptic pruning is mediated by mirror neurons. So what that means is that in the neurotypical brain, the mirror neurons will sort of sync up with the surrounding social group, as mirror neurons do. And if anyone wants me to go into more about mirror neuron function, I'm happy to talk about that. Um, so there's this kind of natural syncing up that occurs, and the synaptic pruning is shaped by which synapses are not very much in use in that social group. The autistic brain does not prune synapses in the same way. Mirror neurons are active, but not in the same way and not to the same extent. So part of what happens is the autistic brain actually doesn't prune a lot of those synapses. So they are left, and that has many different consequences, one of which is that the autistic brain is up to 42% more active than the allistic or non-autistic brain at rest. It also leads to the processing, as we all probably know, of a lot more stimuli that is not being, it's not being filtered, it's not being, not only is it come, it's not being filtered out, but even when it comes in, it's not being habituated in the way that the allistic brain habituates to stimuli. But what that means is that for autistic people, social norms, my pet term for it is we don't get the conformity download, meaning that there is not this automated pruning of synapses that lines us up with the surrounding social group, as well as the mirror neuron activity that also lines us up with this. So what this means is that that process isn't automated. And the way in which autistic people socialize is much more mediated by overactive cognition. So you'll hear autistic people talk about feeling like an anthropologist, or feeling like an alien, or feeling like we're not human, because we're having to expend a tremendous amount of cognitive activity to try to decipher what hasn't been received through those mirror neurons and hasn't shaped the pruning of our synapses. So what this means is that, and it's been viewed historically very much through the neurotypical gaze, which is, well, okay, autistic people are socially compromised or socially awkward or socially impaired, when in reality, if we look at it through the double empathy, it's that we're like two different groups, like neurotypical group and the allistic and the autistic group. We've been socialized very, very differently. And so there's an empathy problem going both ways, but it's only been pathologized in one direction. So what this means is that a lot of social norms, including hierarchy, for example, do not land as normal for the autistic system because it hasn't been sort of received through that mirror neuron system, and it hasn't shaped this, so we all know about justice sensitivity is one of the symptoms or one of the diagnostic criteria for autism, for example. Um, if we look at the ADHD brain, and these categories also are, I mean, both of them are misnomers because ADHD, attention deficit hyperactivity disorder, is a complete misnomer. There is no attention deficit. There's a surplus of attention. It's about regulating the attention. So both of these are diagnostic criteria are already highly problematic. But ADHD, for example, there is an overlap between the task positive network and the default mode network. So in the neurotypical brain, when the brain is focused on a task, the default mode network that is constantly reflecting on the meaning of life or, doing a deep philosophical analysis, that's sort of it's off, right? It's toggled on and off, almost like a brake and a gas. The ADHD brain there it doesn't turn off. And so what that means is that every procedure is now infused with this deep existential kind of analysis or reflective process. And so that also colors how ADHD people are experiencing social structures. And because of the mediation of dopamine release in the ADHD brain, it also works radically differently than the neurotypical brain. So dopamine is not released for routine, for delayed gratification, for reward. Dopamine is released in the ADHD brain for passion, novelty, and meaning. And so that also affects engagement with different social structures and norms and makes compliance with many social norms much more challenging because we end up having to rely on cortisol instead of dopamine. So all this to circle back to PDA, which has been, pathological demand avoidance. So there are many neurodivergent children who will have a involuntary, very strong nervous system response. So go into extreme hyperarousal when being asked to do apparently routine things. So it could be brushing your teeth or getting ready for school or hanging up your coat. Um, this is being reframed, so the acronym has been renamed by advocates as persistent drive for autonomy. And the context for that is that the level of harm that's done to the neurodivergent brain and nervous system by trying to function in a society that has been created for the neurotypical brain and nervous system is so chronic and so impactful that revolt from the nervous system, which has been sort of framed as, I think, a personality defect or, it's actually the nervous system trying to reassert some control over its level of activation. And we can see the same in the way that meltdowns have been characterized. An autistic meltdown is typically pathologized or it's seen as a tantrum or it's seen as a kind of conscious mechanism as opposed to this unconscious, purely automatic mechanism that the nervous system has to try to reestablish some form of equilibrium in the face of chronic overstimulation. And we know that autistic burnout, for example, is radically different than neurotypical burnout because neurotypical burnout begins in adulthood, typically as a response to work stress, life stress, whereas autistic burnout begins in childhood as a result of chronic overstimulation and stress on the nervous system and the strain of masking. So masking all the traits that are required, even masking stimming. So the all the regulatory mechanisms that the nervous system has to try to maintain some kind of equilibrium are not permitted. And so burnout in autistic systems actually it doesn't affect the HPA axis. It's not hormonal. It's actually it's the mitochondria of the cells. So it's cellular and it's quite devastating. So if we look at again that physiological toll that's being taken and we look at the ways in which the nervous system tries to right itself, that's a very different framework than looking at it as recalcitrance or obstinacy or a character defect.
Well, I feel like I'm gonna have to take that little audio and spread it to literally every person that I know because this is not at all the way that we think
No.
about any of this. Um, and now I feel like we need to have a similar critical kind of interrogation of literally every, diagnosis that we have. But I'll leave it there in terms of my question. I mean, I have so many other thoughts and comments, but I'll let others join in.
I I have a question.
Mhm.
Um, I'm just wondering, like, so you got tested, right? You had an assessment, and I'm wondering what made you decide to get tested? What were you experiencing that made you feel like I should get this looked at?
So I self-diagnosed first. And the way that came about, which is actually not as uncommon as you might think. I have three sons, and my middle son was diagnosed with ADHD back in middle school. He's now a young adult. So I wanted to better understand his experience. So I began around just over a year ago, I started doing a really deep dive into ADHD. And for the first time, instead of stopping at clinical literature, I started listening to people with ADHD and reading books by people with ADHD. And the more I listened to them speak and the more I read these texts, and I could not believe the difference between the clinical text written from a neurotypical perspective and the text written from within the neurodivergent experience. In hindsight, to me, it's a lot like, it's like reading a book about the psychology of women written by a man, or reading a book about the psychology of, being African American written by, a white person. Like it's kind of absurd. So the deeper that I went, and the more videos I watched, and the more articles I read, and the more books my book pile is part of my book pile is behind me. And this it sort of became a special interest, which was one of the flags, right? The more I read, the more I listened, um, not only about ADHD, but also about autism, the more I thought, oh, this is me. And particularly the book Unmasking Autism by Devin Price, which is specifically targeted at the group of masked autistic people. So there's a huge number of people who have made it decades to adulthood with autism undetected or misdiagnosed because we are so good at masking. And that is much more prevalent among women, among non-binary people, and among people of color, because we are socialized already to fawn, to manage those with power and to suppress our internal experience. So there's a massive population of masked autistics, and masked autism shows up differently. So doing this deep dive was a massive revelation. It answered, without hyperbole, dozens of questions about lifelong chronic health conditions, about my interactions with so many people in the medical profession who had never been able to find out what was happening. So just one example is my lifelong experience of intense anxiety, despite decades of personal therapy, training as a therapist, a very deep meditation practice, which includes meditating, 45 minutes to an hour daily for years, was never able to really shift this. And when I read that if you're overstimulated, you don't necessarily know you're overstimulated, you just feel anxious. That was a massive revelation for me because my assumption was, well, if I'm overstimulated, I'll know I'm overstimulated. I'll know it's the lights are too much or the sound is too much. But if you've been overstimulated and forced to suppress it from the time you're an infant, you're not going to know that. All you're going to know is that your system is perpetually in hyperarousal. And so that one fact alone has completely changed my life because I can now recognize where I'm at in my stimulation threshold. And I can look back at, the times where I had terrifying experiences of depersonalization in a grocery store. And my only framework for understanding that was I'm having a dissociative episode, I'm having a traumatic flashback, but there's no trigger here. So that was my only, the only framework that was ever given to me through all my clinical training was, well, this is dissociation. But when I recognized it in the context of overstimulation, I mean, a grocery store is one of the most overstimulating environments you can be in as an autistic person. So that one alone has completely changed my life. When I went to a clinical psychologist, initially I thought I only had autism, and she confirmed both. So she confirmed ADHD, and in many ways they seem very at odds with each other, and in many ways they are. It's sort of like having a brain at war with itself. Um, but even though my diagnosis was clinically confirmed, I do want to say it's because it's a very important point that self-diagnosis is viewed as valid within the neurodivergent community for many different reasons. One of which is that getting a formal diagnosis can often be prohibitively expensive. Many people are not trained to recognize maxed autism. And typically, if you're neurodivergent and you suspect you're neurodivergent and you go and read 12 books and listen to 200 hours of people talking, that's probably a pretty good sign that you're neurodivergent. So yeah, so that because that itself is kind of characteristic, right? It's that monotropic focus or that deep special interest where, you learn everything you can possibly get your hands on for it, and it's your entire focus for your life. So that itself is a feature of neurodivergence.
Oh,
Yeah. Did that answer your question?
Um, yeah, I think so. I find it so fascinating, and I don't think I've heard anyone describe. I hear people. Um, I walked by someone yesterday on the street just saying, "Oh, I have ADHD," and talking to their friend. And they're like in their 20s, and I feel like, oh, most of the people I know say they have ADHD. And often I think they mean I have trouble focusing. Um,
Yes.
but I hear it so much, and a number of the therapists I know say they're autistic, and I never asked how they know, but I hear it so much, but I'm always curious about like
Mhm.
how that comes to be and how they know that.
Yeah, I do want to name that. I think there's a slight distinction there between autism and ADHD in the sense that I think ADHD gets thrown around as a casual term. In some ways, I think it's like, oh, that was so, like it's almost like an adjective, oh, that was so ADHD. And there is a problem in the sense that it has become part of meme culture, it has become um, so I do want to tease that apart. People who are using it in a more colloquial sense and have not done the deep dive, have not been assessed or done the deep dive, and the misinformation is a real problem because ADHD actually uh, comes with I mean, the neurodivergent population overall is a population in crisis, and this really cannot be stressed. It can't be stressed enough. So, for example, the suicide rate for autistic women is something like 13 times that of non-autistic women. And the average life expectancy of people with ADHD is 13 years lower than people without ADHD. So these are not, so the misinformation or the way that it's understood in a very superficial way can do tremendous harm because it does prevent people from actually receiving treatment and receiving, having an understanding of what they're struggling with. There are many reasons for that, for those devastating statistics, that have to do with the long history of how neurodivergence has been pathologized, in many different ways and for many different reasons. But primarily, if we really are looking at this as a disability, not through the medical model of disability, but through the social model of disability, which says the problem is not in the individual, it's in a society that has been built for different brains and different nervous systems. So ADHD, for example, it gets either understood very superficially, or it gets understood as laziness or lack of discipline, neither which could be further from the truth. There's an executive dysfunction component, but the capacity for ADHD people to hyperfocus, to recognize patterns, to innovate, is astounding. And there's, a long history of innovators who are neurodivergent. Um, so the fact is that we don't fit into the 9 to 5. We don't fit into, our brains don't release dopamine for this kind of regimented way. Our brains release dopamine when we are in that state of passionate engagement, when we find what we're focusing on deeply meaningful. Um, the same with, the autistic way of functioning. It's near impossible. Like the unemployment stats globally for autistic people are appalling. I have a really powerful graphic which shows over a series of, I think, 6 decades in 6 or 7 different countries, the unemployment rate for the general population and the unemployment rate for the autistic population. And for the overall population, it's usually somewhere between 4 and 8%. And for the autistic population, it's typically between 60 and 80%. And there are many, many different reasons for that, but what it leads to is tremendous financial instability, um, you know, very poor mental health outcomes. And none of this has to do with the capacity to do the work, because many autistic people are typically actually overeducated for the posts that we occupy. But it's the social component. It's the social component, and it's being in an environment which does not take our nervous systems or brains into account at all. So we're chronically overstimulated. We're chronically in this experience of not fitting with the social norms, but not having the recognition that it's a double empathy problem. We've just been carrying the burden of the pathology for decades, right? We are broken. We don't have empathy, or we don't have social capacity. In fact, many autistic people are enormously have hyper empathy and exquisite sensitivity, partly because our brains are so much more active, our nervous systems are so much more active, so we get flooded by social information. So eye contact is a perfect example, and it's one example of something that was just deepened in me through my clinical training. Like, we really look at the refusal or the inability to make eye contact as a sign of pathology. And we say, well, autistic people can't connect socially. Well, actually, the flood of information that I'm receiving when I make eye contact is so intense and so full that to ask me to do that all day, every day is completely overwhelming my nervous system. But that's just
Mm,
one example, right? So you have autistic people who learn how to mask. So not we're experiencing all this and we're covering it, right? We're covering it, and that is taxing our nervous system to the point where that we're in and out of burnout, which is affecting the mitochondria of the cell, all sorts of chronic illnesses. And then we can't maintain jobs, we can't maintain employment. And there are just devastating stories of people with multiple advanced degrees who, because of the social dynamics, are not able to maintain a job in the workforce. And the loss on both sides is really unimaginable, right? If we look at, um, I mean, there's widespread consensus, for example, that Einstein was autistic, right? He was nonverbal until he was 3. The way that he thought. I mean, there's many different examples, but that coupled with the justice sensitivity. So if you look at someone like Greta Thunberg, the activist who began as a climate activist and is now part of the flotilla, going to Palestine, that justice sensitivity, which is an inability to function in systems that are built on hierarchy, injustice, casual toxicity, power dynamics, like an inability to maintain physiological functioning under those conditions makes for, I mean, I knew very young that I could not survive in the corporate world. I did not know why. I didn't have a diagnosis, but I knew that I couldn't do it. I knew that I couldn't pass. And, so this answers so many questions I have about organizations that I had to leave, about dynamics that I could not be a part of anymore, and all the ways in which I felt that marked me as broken, as opposed to it being a reflection of my neurotype and my wiring. So, yeah, there's this real tension between, um, there's, as we all know, there's a massive upsurge in diagnoses of neurodivergence. And part of that is because the masked population is coming to light. Part of it is also because of the casual way it has become a meme. Um, but because this is a population in crisis, because there are very real health outcomes, and we can look also at the statistics around the violence and abuse towards autistic girls and women, which is higher than normal rates. We can look at addiction and criminalization and incarceration of people with ADHD, which is like the rates are astronomical. And again, if we don't bow to the pressure to view this as inherent in the individual, and we again look at where is society not structured to make life livable? Not, it's not possible to make an income. It's not possible to function in the ways we're expected to, especially in late stage capitalism. And what is the fallout from that? So addiction for ADHD, addiction rates are very, very high. And part of that is the nature of the nervous system, which, is incredibly intense. I cannot remember how many times I worked with a particular psychiatrist for close to a decade, and how many times I went to her and said, "Are you sure I'm not bipolar?" Um, she said, "No, you're not bipolar." And, bipolar, if you have a manic episode, it will probably last for at least a few days or weeks or months, and then you'll have a depressive episode. If you have ADHD, you can go from the top of Mount Everest to the pits of hell in the space of half an hour. And that is, there's no moderation. And again, this has been a source of enormous shame for me. And I have only ever framed it as something that's broken in me, as opposed to this is my wiring. Like this is I think it's part of autism. It's part of taking in so much all the time and taking in too much for over 5 decades. And it's part of, um, the intensity of being so impacted by everything. So many artists, activists, musicians, poets, innovators are neurodivergent. But that's not recognized in the DSM, certainly, and it's not recognized in the education system, which isn't really actually good for any of us. Um, but I think in many ways the fate of neurodivergent people is really like the canary in the coal mine. Because we have increased sensitivity, what's being reflected in our institutionalization, our medication, our incarceration, our all of these things, our suicide rates, death rates is really a reflection of how completely toxic and life-denying our entire culture is. And it's just amplified in nervous systems that are more porous and more sensitive.
Mm.
I just want to kind of emphasize because this has been part of our ongoing conversation in this group about the ways in which systems like psychology, like education, etc., um, are essentially kind of arms of the white supremacist capitalist system and culture. And so when you look at it that way, it makes perfect sense. It makes perfect sense that people um, who can't fit into this, what I would really call neurotypical culture, um,
Yes.
are dispensable, and they're meant to feel dispensable. And there's no crying over any of these statistics because the goal literally is to dispense of, the ones that are not going to be able to conform to this.
Yes.
Um, so I want to kind of uh, use that to come back to another point that you made earlier about uh, kind of the part of your journey that really brought you into a deeper spiritual grounding in terms of psychology, in terms of human development, in terms of diagnosis, because I know there's a connection here, but I'm wondering if you can help us name it better.
Absolutely. Yes. So I would say there are many connections. So for example, it's being investigated that the autistic brain, so that the sort of dissociative barrier between self and other in the autistic brain is much, much more porous. Um, so this means an opening to, all kinds of information. If we understand that information is not contained by the brain or the body, it's a field that we all participate in, which is what quantum physics is confirming, but which is really just has been known by indigenous societies and mystics for, all of human history. Um, so the crisis really arose sort of simultaneously in my own healing and in my practice, around Indigenous patients, and particularly around the way that I was trying to, I was coming out of an attachment-based model. I was coming out of a trauma-informed sort of somatic model, but I had no place for ancestors. I had no place for creator in my understanding of what healing would look like. And so when I was doing this very deep experiential work, I was doing a lot of parts work. Um, what would repeatedly come into the room would be the presence of ancestors or creator or excuse me for one moment, other beings, other non-human intelligences. And I I was open to those things intellectually. I was open to those things to some degree through my meditation practice and through a sort of lifelong yearning for like a very deep connection to plants, to animals, and a feeling that we had it terribly, terribly wrong in terms of how we interact with the non-human world. But I think I was called into a different level of accountability and a different level of healing, and so that brought about a lot of reading and listening and researching and working as a patient with a medicine woman who would call upon these other presences during a session, and there was something about that activated s- such a profound grief in me. I almost didn't have, I mean, I don't think I've ever really found adequate words for it. And a sense of a fragmentation in myself that was a reflection of the fragmentation in the dominant culture and specifically in white culture, um, being socialized as white. Um, and so when I began to receive move into receiving teachings and receiving rights, which involved, many months of different exercises that called me into a different way of knowing, like knowing through ceremony, knowing through heart intelligence as opposed to analytical intelligence. Um, that that sort of set me on this two-pronged path, which is how do I process my complicity in colonization? Um, how do I face my ancestry as someone who's complicit in harm? What do I do to rectify that now? And how do I process the enormous ancestral grief of the severance that occurred in my lineage to this interconnection with all life? And so that was something that was happening. It was happening intellectually, it was happening politically, it was happening emotionally, it was happening spiritually, and it was impacting every aspect of my life. Um, but what I came to an understanding of was that the same way, trauma can only be healed through integration. Like this cultural split calls us into an integration that can't just be intellectual. It can't just be about insight. It can't be just that, oh, I see I'm broken or I see I'm missing this. We have to face the wound. Um, and for me, there's a very powerful parallel that I'm continuing to flesh out between my experience doing parts work with very severe dissociation and the kind of healing that this called me into. So, for example, um, when I'm working with someone, and I have worked with people who have been given the DID diagnosis and who are very close to that on the spectrum. In my experience, when we are seeking to reintegrate a child part that is holding tremendous trauma, um, there's there's defenses, right? There's terror, there's facing all of the original trauma that part holds. And once that trauma can be felt and metabolized, then we regain access to the part as they really are. And very often, visually, there's a transformation of how that part appears to the psyche of the patient. So this part that might initially appear as monstrous or disfigured or inhuman, once we have the resources to metabolize the trauma, what we actually see is a part of the psyche that is innocent, that is whole, that is part of our humanity and our vitality, and that's what allows integration. Similarly, when I was beginning these practices that called upon me to be in dialogue with spirit, I I was in such intense, sustained fear that I was going crazy because my only clinical framework for what I was experiencing was, oh, this is psychosis, right? It's psychotic if you have a dialogue, if you receive information from a plant. It's psychotic if you have a dialogue with a river. And again, that's a reflection of how broken all of our diagnostic criteria are and how implicated they are in, the sickness of the wider society. So the way I came to understand that was this is this is the collective psyche, right? This is what the witches were burned for, right? This is who the pariahs in our culture are. They're the pariahs who have said God is everywhere, and we don't have to use the word God. We can just say intelligence is everywhere. Consciousness is primary. We are all entangled. Consciousness is not limited to my brain or your brain. We are part of this living field with all sentient life. Look at what we've learned about mushrooms and the mycelial network and the forest as an organism. Trees communicate with each other. They share resources. They warn each other of predators. That kind of recognition of the fact that intelligence permeates all of creation is what we've been severed from. But that's one thing to entertain intellectually, it's another thing to experience directly. And so my understanding was I am now processing ancestral trauma, right? I'm processing the collective split, the split in the collective fragmentation, the collective dissociation from because all of us at some point are descended from an indigenous people who lived in earth honoring ways, and we're connected to sentient life. That's the reality. You know, there's huge variations in how far we are from that original history. Um, so in terms of the connection to between spirituality and neurodivergence, um, I I mean, this is something that I'm continuing to explore. I think that the level to which my entire life had to change for me to seek these answers is in some ways a marker of neurodivergence. I could not continue to function. I could not, and I wanted to. I have wanted to be quote unquote normal my entire life. And I've held that with such pain, the ways in which I don't feel like other people. But I think, you know, the fact that I left academia to become a therapist and I left therapy, you know, and I challenged all the paradigms. I mean, I think all of these are markers of the way my brain and nervous system work. Um, and you know, a lot of people sort of look at that askance, like, why don't you just pick one thing and stay with it? And that has never sort of been an option for me. So there's a lot of material out there about neurodivergence and spirituality. There's a fascinating podcast. It's now being developed into a documentary. It's called the Telepathy Tapes. Very, very controversial. But essentially, it is investigating and taking seriously the claims that family members and teachers of nonverbal autistic people have been making for decades, which is that these nonverbal autistic children and youths are able to read their mind. And of course, this causes a massive backlash because it contravenes, you know, one of the main principles of Western science, which is materialism, which is that matter is primary and consciousness is a property of matter. So if you're over there and I'm over here, there's no way my brain can be talking to your brain. But if we look at an indigenous perspective, if we look at a quantum perspective, if we look at a mystical perspective, just stay with science if anything else makes you uncomfortable. I mean, this is what indigenous cosmologies are built with. This is what quantum physics tells us. Consciousness is primary. Matter is just a form that consciousness takes. So, of course, we're entangled. Um, so that podcast I found incredibly compelling. Um, we had a nonverbal autistic guest actually last on our last module on capitalism when we were talking about how profoundly we have dehumanized anyone who doesn't embody the kinds of intelligence we can measure. And so I would urge anyone who is curious about following up on that to listen to the telepathy tapes. There's also an incredibly powerful video made by nonverbal autistic advocate Mel Baggs, and it's called In My Language, and really conveys from the perspective of nonverbal autism how violently limited our understanding of intelligence is in the so-called civilized world. And we can trace all of this back to what had to be suppressed to create capitalism, right? The indigenous societies in Europe, the witches had to be burned because they had communal culture. They had women had power. There was interdependence between humans and non-human. You know, there was a deep relationship to the land. Oops, sorry. I forgot my light is on a timer. So the suppression of indigeneity, hold on, that's really bright. Just give me 1 second. Excuse
No
me.
worries, take your time.
So the suppression of indigeneity is not incidental. It's the basis of our whole culture and it's the basis of all our diagnostic criteria as well. So everything that gets pathologized, um, non-linear ways of perceiving, right? Outside the west, the left brain or the analytical mind, that gets pathologized. Sensitivity gets pathologized. Um, Intensity, emotional intensity gets pathologized. These are all means by which we experience our entanglement with all of life. But what has been set up as the standard, the universal standard for human, wellness and sanity is the European cis hetero male, which is also it's also an ideal that has become deeply intertwined with compliance. Um, and this is what our education system teaches us to be. It's what our medical system is based in. And everything that we pathologize, particularly about neurodivergence, has to do with either qualities that are feminine, that don't serve capitalism, or that have that kind of indigeneity in them. And of course, the reasons when we look at it is if we were all to wake up and recognize that um, the economy makes no sense, and we are entangled with all of life, and we are all divine, or again, if that word doesn't make you, makes you uncomfortable, we are all sacred. All life is sacred, and um, our connection to knowledge has nothing to do with how well educated we are, what our IQ is. It has to do with our permeability to this field. So if you look at, for example, Nikola Tesla, the way that he spoke about his inventions, and he's also widely speculated to have been neurodivergent, his inventions came to him wholesale as images from the field, right? But that way of understanding knowledge and transmission of knowledge is very subversive and dangerous to the power structures and the way that everything works. Um, yeah, I've sort of lost track of your original question.
No,
Not
no,
sure how I
no.
answered it.
No, you absolutely did. And I think, as you're talking about this, I keep, the what you said about the suppression of indigeneity is at the basis of all of our diagnoses. And then I'm thinking about that, and I'm thinking about, kind of the other big theme that we've been following in our group for the last many months, which is essentially what is happening in Gaza, which is this really like vivid in all of our faces. We're not thinking about it historically. It's happening in the
Yes.
here and now suppression of indigeneity, and sort of seeing how maybe kind of at this later stage, uh, the we're seeing what the system has to continue to do, even at the price of it beginning to eat itself, which is right
Yes.
now what we're seeing in the West. But it has to, because that is the only thing it knows how to do. And then also the way that that connects to this idea of spirituality, because I think one of the things, um, I keep thinking of this interview that this young German journalist had with John Mearsheimer about Palestine. And she kept saying, well, okay, well, I don't understand. Like, why don't they just leave? Like, what, it's not getting better. This other side is obviously much more powerful. They're not going to win. Why don't they just leave? So that they can be alive. Um, and it's sort of kind of missing the whole entire point of understanding that this is not a fight. This is a fight for something completely different. And it feels right now like almost like humanity's last scream. Um, and Gaza's sort of become this, like, if we lose this, then we've completely lost to the system. Um, and I think that maybe somehow that is beginning to wake people up here on this side a little bit. And people are like, wait a minute, like, we didn't realize this is what we're complicit in. And then, as you said, beginning to then understand, well, how that reflects, like how did we arrive here? How is it possible that this culture that we thought was all about like democracy and values and this and that is actually exactly the opposite thing. And I think there's a collective shock right now. It might be a little bit different for you guys in Canada, but I think it's global because the US does kind of have such a global space, like with all that's happening. I think everyone's like, um, I guess I'm saying all this to say that it seems like it's a powerful, it's a really devastating moment, but it's also maybe a really powerful moment for shifts, for changes. Um, and one of the calls that I have, whether it's in this group or in other spaces, is the the importance of recognizing for those of us who are in these, so-called healing professions, the importance of recognizing that our job, um, what is the difference when when we conform to what the system tells us our job is, as opposed to when we let that go and actually step into the power of what our job really is.
Yes.
And that's how I feel like all these things connect. I don't know, that wasn't a question, I guess.
No, but
I'm
that's
just
it's such
speaking
a
out loud.
beautiful framing. Because I think, part of what you're gesturing towards is like the stepping out of the collective gaslighting, right?
Right.
That we have essentially been living in a completely inverted world, right? In which those who have the power in many cases are the least equipped to have it. And so again, as I have been in various rounds of processing around white privilege and white fragility, like how did I experience my own fragility, and being able to witness that from the inside and work with it and see how it functions. Um, I see a very strong parallel between the kind of mechanisms that operate in the individual psyche and what's happening in the collective psyche. And I think we've reached this crisis point where the systems are eating themselves, where, capitalism cannot continue the way patriarchy cannot continue, white supremacy cannot continue. And we have this, as before any really deep transformation, we have the clinging, right? The ego, the psyche clings to what it knows. It doubles down because the transformation is so terrifying, because it is not only the death of a self, it's the death of a world. Every self carries a world view. Um, and so what we're witnessing, I think, is the sickness of supremacy. How do privilege and supremacy make us deeply, deeply sick on a spiritual level?
Mhm.
Primarily because the more privilege we have, the more superiority we're conditioned to have, the further we actually are from our felt and known entanglement with all life. And so that makes us sick. We become more and more fragmented. We become more and more bereft. We become more and more hungry. But if we're not given the pathway to integration, to healing, which is I have to face my sickness. I have to reckon with my sickness. I have to mend. I have to integrate. Then all we do is we project and we repeat, right? So that's where appropriation comes from. That's where domination comes from. It's like on some level, I recognize the indigenous population has something I don't have anymore,
Mhm.
right?
Mhm.
And I don't know how to get it without facing some really uncomfortable truths. So I'm going to try and do it. I'm going to try and dominate and control externally what I actually need to be facing and metabolizing and owning internally. And so we see this geopolitically. We see humanity's shadow splattered in such graphic terms, like terms we can, no one can really ignore. And so I believe it's really fracturing people into people who are doubling down on defenses,
Mhm.
denial, deflection, acting out, and people who are being pulled into this process of accountability on every level, which can mean like how, how you interact with your family members or how what you choose to do for your profession or um, I think we're being called into that kind of integrity that you're naming.
Yes, reluctantly,
Mhm.
simply. Okay. Other thoughts, questions? I feel like we are going to need some deep breathing exercises to help us metabolize and process this today.
Yes. Well, we can take a moment if that feels appropriate just to tune into our bodies because again, that's just like rest is revolutionary, like attunement to and honoring the body is revolutionary, attuning to our nervous systems, honoring what they're telling us, honoring their intelligence is
How do
revolutionary.
people feel about that? Yes. Okay. Okay.
Okay, so for those of you who are comfortable participating, I invite you to do whatever feels aligned and right to you. If it feels all right, I do invite you to close your eyes and to just become aware of your breathing. So, not trying to change it in any way, just noticing the natural rhythm of your breath, allowing it to flow in and out through your nose. And consciously allowing the muscles around your eyes to soften, letting your jaw hang slightly open, and letting your shoulders drop. Now inviting your breath to slow down just a little bit. If your mind is being carried away by thinking, you can silently repeat the word in on the in-breath and out on the out-breath. Edges of your eyes are soft, jaw is slightly open, shoulders relaxed. And inviting your breath to get just a little bit slower. Becoming aware of your bottom ribs. Just noticing how they flare out to the side on your in-breath and come closer to your core on your out-breath. Letting your attention stay with your bottom ribs for the next few breaths. Edges of your eyes are soft. Jaw slightly open, shoulders dropped. Inviting your breath to slow down just a little bit more. And now allowing your awareness to rest in the area around your heart. Just noticing the quality of the energy here. It feels still or flowing, open or closed. In a moment, I'm going to say a few words, and I invite you to listen for the response that comes from inside you. So, listening for the response that comes from your heart. Right now, what matters most to me is in this moment, what matters most to me is I am willing to fight for I am willing to fight for Now I'm going to invite you to allow your awareness to rest just behind your closed eyelids. Take a moment to really solidify the information you received. And on your next in-breath, gently opening your eyes. I'm going to type in the chat what the two prompts were. Start with the first one. Anyone who would like to share what came to you right now, what matters most to me is, I'll share the answer I got. right now, what matters most to me is thank you, love, connection, family, God, connection, family, love in my family, wife and dog, health. Beautiful. Thank you so much for sharing. And I will put the next prompt. I am willing to fight for the answer I received. I am willing to fight for truth, justice, liberation, my community. I'm tired of fighting. I hear you. Love and others, balance, justice. Beautiful. Thank you all so much for sharing and for your presence here tonight. It was really lovely to be a part of your group, and I deeply appreciate the chance to do so.
Kristina, thank you so much. I have another class that I teach right after this, and that meditation took me so deep. I don't know if I can climb back up. Um, but this was so incredibly special. I am going to reach out to you to get all of your information, not just for all of our group members here, but I'm very deeply connected to the community that works around neurodivergence in Los Angeles, and I feel like your voice is just an absolutely important voice to get out there. So I'm going to reach out to get everything so that we can do that. And I have no doubt that, at some point down the line, we're going to ask you to come back because I feel like this will be, an ongoing conversation for us here. And I'm personally going to be taking all of your courses. So we'll see. We'll see.
Can't wait to have you, Bibi. And yeah, my hope is that it reaches as many clinicians as possible. And I'm happy to share all my. I'm just sorry. I'm just trying to read the chat at the same time, which I'm not terribly good at. Um, Grateful to share self-discovery reading list. More information, workshops. Wonderful, wonderful. Yes. So, Bibi, you can share my website. Everything is on there. I would love to hear from any of you who have specific questions, either about either course or about anything that I shared tonight. I'm happy to share resources, materials. Would love to see you. Yeah. There's a free info session about the course. A neurodivergent rising course on Monday, this coming Monday. There's also an intro video, which I believe you have access to, BB. It's at the top of my TikTok profile, and there's lots of information on my website. I would love to come back, and I would love to hear from any of you.
Thank you, Christina. We'll be in touch. We'll be in touch. Thank you.
You.
Thank you, everyone. Lovely to see you. See you in 2 weeks. And I'll send the recording to you as well, Christina.
Wonderful. Thank you.
Okay, thank you. Bye.